I tried to do this NEET UG. I dropped 1 year, but then some problem appeared. The exam got cancelled. This and that. Lots of things happens. I decided that I have to have an option B. Main reason of choosing Kazan State Medical University was because of these things. First of all, it is one of the best universities in Russia.
Because after going there, things change. What we see on YouTube, for example, if I'm making a video on YouTube regarding Kazan or any other university, it looks very good, like a fairy tale. But after reaching there, it's different scenario.
तुम फेल हो जाओगे, पास कोई नहीं करता. Anatomy में ये है, this teacher is in anatomy, this teacher is in medicine. Therapy में ये है, कोई पास नहीं करता. ये लोग 6 साल बैठे हैं. कुछ लोग कम टाइम में पढ़ के अच्छा मार्क्स लाते हैं. कुछ लोग घंटों भर बैठे हैं, रट्टा मार रहे हैं. कुछ नहीं, nothing.
Can we give PLAB exam without passing FMG exam? Red diploma has much more importance in Russian Federation because after getting that red diploma or red degree, you can pursue your PG at Russia free of cost in any university in Russia. You are traveling to different cities, maybe due to research work or any other thing, but how you manage and how you got that opportunity while preparing for FMG exam, simultaneously you cracked this PLAB examination, and that was that is the huge achievement. So how you did that?
But for PLAB Part 2, it is important that you have some clinical experience.
So good morning everyone, my name is Dr.Shinjit Mani and you're watching my channel Earthly Existence, and today I'm with a special guest and my dear senior, Dr. Shinjit Mani, who graduated from State Medical University, and he also cleared his FMG exam as well as he got his GMC registration, that is after passing PLAB examination, PLAB 1, PLAB 2, and today I have invited him on my podcast to share all his experience from medical school days. So welcome sir.
Thank you so much, and I'm really happy to be here to talk everything, right, and give you all the things that you want to know. तो जो भी है बहुत दिनों बाद आज बैठ के बात हो रहा है तो अच्छा लग रहा है. Let's move on with the podcast, right?
My first question to you is, sir, what first inspired you to pursue medicine?
Well, actually, मैंने कभी सोचा भी नहीं था कि मैं डॉक्टर बनूंगा. No, my family, everyone is engineer in my family. तो बचपन से यही पता था कि इंजीनियर ही बनना है. So that was the dream. But high school, especially during my 12th, gave my everything in mathematics, but when the result came out, I was terrible. I did terrible in maths. So I mean, वो marks लेके तो आप engineer नहीं बन सकते. But the miracle was कि मेरा biology का जो marks था was more than anyone can expect. Right? मैंने hardly biology पढ़े थे 4 दिन exam से पहले.
Okay.
तो that gave me a marks more than 95. तो मेरे जो biology के teacher थे वो मुझे बोला कि तू अच्छा है इसमें, तू डॉक्टर क्यों नहीं बनता? You know, that is why it got triggered कि actually I can do it. Okay. So also I couldn't before because no one was the doctor in my family and no one was there to inspire me.
Okay.
Anyway, तो वहाँ से ये thought चालू हुआ कि हाँ मैं भी कर सकता हूँ because I'm good at it. So I tried to do this NEET UG. I dropped 1 year, but then some problem appeared. The exam got cancelled. This and that. Lots of things happens. I decided that I have to have an option B. Yeah. So for that option B, I wanted to look outside India. Okay. Now from there, the hunt started. Which is the best place to go outside India? I was preparing for the next year, NEET UG, but at the same time, I was also looking actively admitted everywhere outside India. So that is mainly my story of why and how I came into medicine or doctor कैसे बने. So there was no such thing as as drive to go मुझे doctor बनना ही है. I became a doctor because I just could become a doctor. Okay. As simple as that, right? Okay. Maybe some people could be jealous of me, but yeah, that's the truth.
So, why did you choose Kazan State Medical University in Russia for medical studies?
Main reason of choosing Kazan State Medical University was because of these things. First of all, it is one of the best universities in Russia, no doubt. Secondly, all the education and all 6 years is in English. That I confirmed. वो मैंने पूरा का पूरा confirm किया जो भी पास आउट थे, और ये भी confirm किया कि कौन से यूनिवर्सिटीज में complete course इंग्लिश में नहीं है. कभी ऐसा होता है कि कुछ बोल रहे हैं कि हमारा इंग्लिश में है, but it is not like that. These are the things. And third is it was cheaper than Moscow and St. Petersburg. Now Moscow में भी अच्छी यूनिवर्सिटीज है, they are the top in Russia, but the living cost is too much, which I cannot bear, right? Yes. और उसके बाद था कि ट्यूशन फीस. So I had options कि जब मैं 2 साल ड्रॉप किया और लास्ट टाइम जब मैं NEET UG दिया तो मेरे पास ऑप्शन था प्राइवेट में. The cost was too much. So that is why I decided to go to Russia, because by that time the visa was already done, all setup was already complete, and I had to choose either go to Russia or stay back in India and do it from privately to college. मैंने देखा कि भाई opportunities ज़्यादा हैं, you have to spend less.
Exactly.
So it was the best option that I could take. So I decided to go.
Yeah, exactly, sir. But now the current scenario is that Kazan is one of the, I will say, the costliest university we have these days.
Unfortunately.
I guess that's due to overcrowding. What has been happening year by year. But this year they have managed it properly, so that upcoming years the standard of university will be maintained. Because how it works in India. Once any university get promoted a lot, and everyone wants to go there. But it's not like that. You have to. You should have some standards. At least you should pass the entrance exam and all. So these days they have entrance exam also. So that's
exactly that is also my point, because if you are taking some students and if you are a good university and want to maintain that standard, you have to have some skill. आप सबको नहीं ले सकते. अगर आपको why is AIMS, because they are taking the best of their minds, best of the minds that are available. That is why AIMS is AIMS. Exactly. Why IIT is IIT, because they are getting the cream of the society. So if you want to stay a good university and provide the good education, you have to have not only good teachers and good infrastructure, you have to have good students who are actually going there to study. जो लोग पढ़ने के लिए नहीं जा रहे हैं, उनको लेने का कोई मतलब नहीं है.
Exactly.
So that is a good thing that they did.
Okay, sir. I will move on to next question. What was your initial experience like moving to a completely different country like Russia? Why I ask you this question is that because after going to Russia or moving there is always a self-doubt. Like have we made a correct decision or not? Like we doubt ourselves, because after going there things change. What we see on YouTube, for example, if I'm making a video on YouTube regarding Kazan or any other university, it looks very good, like a fairy tale. But after reaching there, it's different scenario. Like seniors must be telling us, like they were used to say that why you came here and all that stuff. So how you manage?
हाँ, ये एक अच्छा क्वेश्चन है. ऐसा सेम चीज मुझे भी बोला गया. जिस दिन मैंने कजान में पैर रखा, उसी दिन रात को एक इंट्रोडक्शन हुआ हमारा एक हॉस्टल में. तो इट वाज रियल इंट्रोडक्शन, जस्ट रेगुलर इंट्रोडक्शन, लेकिन उसमें बहुत कुछ चीज बोला गया जो मैंने एक्सपेक्ट नहीं किया था कि यहाँ ये होता है, ये डिफिकल्ट है, दिस इज वेरी डिफिकल्ट. ठीक है, तुम फेल हो जाओगे, पास कोई नहीं करता. एनाटॉमी में ये है, दिस टीचर इज इन एनाटॉमी, दिस टीचर इज इन मेडिसिन. थेरेपी में ये है, कोई पास नहीं करता. ये लोग 6 साल बैठे हैं. I know many teachers who have told me कि भाई हमें फेल करने के लिए एग्जाम नहीं लेते. No one takes. My own mother is a school teacher, primary school teacher, but no, from her I understand, looking at her, that no teacher in the world, be it the therapy teacher or your anatomy teacher, no one wants to take exam to fail you. Exactly. They want you to pass. They want you to study. Because you were there to study. It's as simple as that. तुम मजे करने के लिए नहीं गए हो, उधर पढ़ने के लिए गए हो. हाँ, इसका मतलब ये नहीं कि तुम मजा छोड़ दोगे, लाइफ एंजॉय करना छोड़ दोगे. But there are times. तुम्हें पढ़ाई के टाइम पढ़ाई करना है, एग्जाम के टाइम सिंसियरली एग्जाम देना है, and you will pass. I have seen many people pass in first attempt. Right. So वो तो अलग बात है कि सेल्फ डाउट तभी आता है जब तुम सिंसियर नहीं हो. In academics, I would suggest every student who are going there to learn how to study. How to study means you cannot just open your book and study. That is not the way to study, right? बहुत टाइम मिलेगा पढ़ने के लिए. हर मॉड्यूल के बीच में 1 महीना टाइम मिलता है कि 1 हफ्ता टाइम मिलता है, जो भी है. ठीक है, कुछ लोग उसी टाइम के अंदर पढ़ के टॉप करते हैं, बाकी लोग उसी टाइम के अंदर पढ़ के फेल भी होते हैं या ना. What is the difference? Difference is in technique mainly. So technique तुम्हें जानना है पढ़ने का, or at least in first year of your study, because later on you won't have that time. जब आप थेरेपी के एग्जाम दे रहे हो ना 4th year में, वो टाइम नहीं मिलेगा. You need to have all those techniques tip of your tongue. You have to master all those techniques before you go to 3rd year. Now that is the difference. कुछ लोग कम टाइम में पढ़ के अच्छा मार्क्स लाते हैं, कुछ लोग घंटों भर बैठे हैं, रट्टा मार रहे हैं, कुछ नहीं, nothing. That is the difference. Second thing is you have to accept that not everyone is built same. ठीक है, सबका अप्रोच सेम नहीं हो. तो कोई एक होता है जो 1 घंटा पढ़ के पूरा का पूरा सब्जेक्ट उठा लेगा, रात को पढ़ के पूरा सब्जेक्ट रट लेगा पूरा. Everyone, he will do everything in one night. And there were others who have to study the same thing throughout the week to get the same effect. I was the second time. I never had any passing by studying one night. तो मुझे हार्ड वर्क करना पड़ा. तो मैंने जो किया वो मैं बताता हूँ। जो क्लास हो गया, मान लो आज शाम को क्लास खत्म हुआ, लेक्चर खत्म हुआ, आओ वापस आओ और एटलीस्ट पलट के देखो तुमने जो नोट्स लिया है। अगर नोट्स नहीं लिया, एटलीस्ट फोटो भी लिया है ना अगर लेक्चर्स का, तो वो भी पलट के देखो एक बार। तो एटलीस्ट वो फर्स्ट रिविजन होता है। कोई भी चीज अगर तुम्हें मेमोराइज करना है, सीखना है, तो उसके लिए तुम्हें रिविजन करना जरूरी है। रिविजन इज द की, ठीक है। एक बार फर्स्ट रिविजन हो गया, देन यू कैन गो बैक टू दोस थिंग्स बिफोर योर टेस्ट और मे बी ड्यूरिंग संडेज और सैटरडेज। उसके बाद तुम्हें ज्यादा पढ़ने का जरूरत नहीं हो, रट्टा मारने का जरूरत नहीं है एग्जाम के पहले। सो दीज आर द स्मॉल थिंग्स आई इंकॉर्पोरेटेड इन माय स्टडीज। और हाँ, हार्ड वर्क था, बहुत सब कुछ छोड़ के पढ़ना पड़ता था मुझे, तभी जाके अच्छे मार्क्स आए, ठीक है। एंड उसके बाद आता है सैक्रिफाइस। यू हैव टू डू सैक्रिफाइस।
Yes, so why I asked this previous question is that because your journey, because as being a junior of yours, I have seen your journey. You got red diploma. That is, well, let me explain what's red diploma. Red diploma in Russia is a thing like if you get in each subject of your university above 90% marks, you get a red diploma. And there is another diploma that is the normal one, that is a blue one. But the red diploma has much more importance in Russian Federation because after getting that red diploma or red degree, you can pursue your PG at Russia free of cost in any university in Russia. That's the plus point. Apart from that, it's very difficult to earn this red diploma thing because only 1 or 2 students get it from 300 students. So how you manage that consistency of studying, as well as I have seen you are not only studying, you are a perpetual traveler. You are traveling to different cities, maybe due to research work or any other thing. But how you manage and how you got that opportunities, because this year in October students gonna fly to Russia, different university, and each university has the same opportunities as we had at Kazan state. So please elaborate something about that and how to become or how to remain active in your university days.
So there are a few things to talk, right? First of all, how to get the red diploma. Secondly, how to be active. So let's talk about the red diploma. It is basically a honors diploma. जो गोल्ड मेडल होता है इंडिया में, वो सब्जेक्टिव होता है कि आपको इस सब्जेक्ट में गोल्ड मेडल मिला है। बट इन रशिया यू हैव टू कंसिस्टेंटली गुड एट योर एग्जाम, राइट? यू हैव टू बी getting 90% in every exams. Maybe there are a few options like कुछ 3-4 छूट जाते हैं तो that is still accepted, but you have to be consistent at it. Now I would say sacrifice is the most important one, क्योंकि लोग जब घर के बाहर जाते हैं ना, हर किसी को ये मन करता है कि भाई थोड़ा मजे कर ले, थोड़ा घूम ले, तो क्लास के बाद चले जाते हैं, सैटरडे संडे को निकल जाते हैं घूमने। No, you need to choose. If you want a red diploma, you have to sacrifice this. There will be time to enjoy. Summer vacation आता है, समर वेकेशन में तुम 1 महीना रह जाओ, घर में मत जाओ, घूम लो दोस्तों के साथ, प्लान करो घूमने का। लेकिन जब पढ़ने का टाइम है, यू हैव टू स्टडी ऑन टाइम। और एक चीज है कि लक मैटर लगता है। हाँ, और ऐसा नहीं है कि रेड डिप्लोमा नहीं आया मतलब ऐसा नहीं है कि यू आर नॉट अ गुड स्टूडेंट। नो, that person whoever gets red diploma is consistent, is hard work. That is what differentiates, and maybe sometimes lucky. चलो उसके बाद कि how to be active in your life, in your college life. What I did was I was interested in research, so there I had to look for options, क्योंकि वैसे तो research का option होता नहीं है, और ज़्यादातर अगर आप foreign graduate हो, if you are a foreigner in Russia, there are very limited opportunities. Now you need to look for opportunity. You have to approach your seniors or approach your professors, ask them if there are any research going on, if they would like to take you in, that tell them that you are interested.
Exactly.
No one will say no unless and until that person is like really do not want someone else in their project, or maybe that project is very confidential, they will not say. And उसके बाद होता है कि not everything is your cup of tea. I liked research, so I went into research without any doubt. और हाँ, जो घूमने का बात है तो मैं कैसे घूमा, mainly I wanted to travel, no doubt about it. But my travel was mainly due to research and presentations, conferences. तो पहले in third year में मैंने ज्वाइन किया रिसर्च वर्क पैथोफिजियोलॉजी में, पैथोफिजियोलॉजी एंड पैथोलॉजिकल एनाटॉमी। तो दोनों में कुछ रिजल्ट्स आए एटलीस्ट स्टैंडर्ड, तो वो पब्लिश किया मैंने इंटरनेशनल कॉन्फ्रेंसेस में। उस कॉन्फ्रेंसेस में जब एक्सेप्टेड हुआ तो they give you an option to come and present your research. Sometimes university also pays you or reimburses you to some extent, maybe 50%, maybe 30%. That's a good thing. So that was my way to find my opportunity. Research करना, घूमना, सब कुछ एक साथ कर। और हाँ, difficult. It is difficult, no doubt.
like what first thought came into mind that you have to enter the system of UK, that like through PLAB examination. So why you did that? And apart from that, you passed the FMG exam. That we know. But while preparing for FMG exam, simultaneously you cracked this PLAB examination, and that was that is the huge achievement. So how you did that?
Yeah. So, let's talk about PLAB first. So, PLAB, many people have this confusion that PLAB is an exam which you pass and get into a job. That is not how it is. It is basically same as FMG, right? You pass it to get your registration. If you pass FMG to get registered in India, and you passed PLAB step 1, step 2 to get registered in UK. As simple as that. Now, these two exams are very similar because they are both of these exams, FMG and PLAB part 1, both of them are theory based, right? So if you have the basic knowledge of medicine that you studied in 6 years, this should not be difficult for you. Then if you are preparing for it, it should be easy for you to pass PLAB step because content is basically same. And कोई एक दिन में कोई नया डिजीज तो नहीं आ जाए, नया कोई थ्योरी तो नहीं आ जाएगा और ना एनाटॉमी चेंज नहीं हो जाएगा. So these are the same things, same disease, same topics that you have to study for both FMG and PLAB. That is the first thing. और तो ये मुझे पता था. So most important is to have the proper knowledge. Second thing is to have proper plan set up before it. So I had other options like USML, but I choose PLAB, maybe for good or bad. I don't know yet how situations have changed. But main reason था कि मुझे research में जाना. तो जब मैं I was still novice in this research thing. I was attending these conferences, and luckily all these conferences become free of cost for the students during COVID time, because it was like first time they're going online if they want to join everyone. तो मुझे बहुत सारे अच्छे बड़े conferences free में मिले थे join करने के. Because of my interest in cancer, I decided to pursue this path in medicine in UK. India में वो चीज है ही नहीं, translational research का कोई option ही नहीं है इंडिया में. तो जब मैंने देखा कि कोई option नहीं है इंडिया में, तो then let's go to UK, because that's where I want to pursue my life, pursue my dreams.
Exactly.
From there I wanted to I had this thought of going to, not because of money. अगर आपको पैसे चाहिए, go to US. Straightforward as that. That gives you more payment than UK. Even Australia gives you more payment than UK.
Australia.
UK is nowadays is one of the average payment countries for doctors. It's very average. To be
Same
honest.
like Russia, we will say, like same, near about same.
रशिया में तो बहुत कम है.
Exactly.
That is very less. जो लोग जानते हैं उनको पता है, बहुत कम है. In UK, it is still an average, but the economic situation, the way it is going, will not get better. मुझे तो नहीं लगता कि अच्छा होगा. So they are having this brain drain. वहाँ से जो लोग graduation कर रहे हैं MBBS में, they are going to Australia, New Zealand or Canada or US in those. Right? तो ऐसा situation उधर है. That is the situation at the point of. लेकिन जब मैंने सोचा था कि मुझे जाना है UK में, तब ऐसा situation नहीं था. So things have changed. Now, चलो प्लान कर लिया UK जाना है, तो UK कैसे जाए? First you need to know the things, the basics. कौन से एग्जाम चाहिए? What are the documents you need? What are the things you need to arrange? पैसे कितने चाहिए? तो ये सब के लिए तो कुछ ना कुछ होगा. हम तो 6 महीना लग ही जाता है. So it took me like by the end of third year I decided to go to UK. Right? Third year के end में मैं तामसा का exchange program में गया. IFM is the exchange program. I was lucky enough to get a seat. So I was the only Indian student who actually got selected and went to the exchange. The exchange program भी मुझे luckily Department of Oncology में ही मिला था, Croatia. That was a really good experience. The Croatia, it was a really good experience. So this was an opportunity that I didn't want to miss, and I'm glad I didn't miss it. So I had a really great experience there. That is the place where I got the first experience to see cancer patient. लोग जाते थे, 2 घंटे बैठते थे क्लिनिक्स में, जाकर बैठ के आ जाते थे. Let's go to the beach, let's have enjoy this thing, that thing. It was a social gathering. People take it as no one wants to go to an exchange program to visit the clinics, right? But since I was interested, I spent till 12 noon to sit in the clinic and watch the patient and watch the doctors, what they're doing, how they're doing. The doctors there would tell me, you are in exchange program, go to the beach, we have beautiful beaches, enjoy the weather. This is summer, it is your time to enjoy. You will learn oncology, you will learn everything, but maybe this is time to enjoy. I was like, yes ma'am, I am going to enjoy my life, but this moment I don't want to waste, right? अगर 12 बजे तक क्लिनिक ऑन रहता है, क्लिनिक चलता है, I want to sit there, I want to, because you don't know, maybe the last patient is the interesting. आखिरी पेशेंट आता है कुछ कॉम्प्लिकेशंस लेके, कुछ ऐसा चीज लेके जो आपने नहीं, एंड इट हैपेंड टू मी. Other people left, I was there, and I saw that thing, that rarest thing, maybe that rarest symptom, that rare complication, which other didn't. So that gives you experience. That actually gives you more exposure, and it increases your interest. So I was like damn sure कि भाई मुझे UK जाना है. I want to do oncology as specialty.
So in short, I will sum up like you wanted to take experience of a particular system. You got it through via this research stuff only, and after that, when you passed your further PLAB exam, and you got the same environment, and so things were pretty easy for you. So apart from that, I want to add one question here is, for example, if the student don't want to give FMG exam after graduating from Russian Medical University, is it possible that we can we give PLAB exam without passing FMG exam?
It is still possible. It is still possible because there is one person I know. I don't know her personally, but I know at least, from those social media profiles that she passed from Ukraine. Then without giving FMG, she passed PLAB step 1, step 2 and joined foundation year 1.
Yeah.
So you have to understand these concepts of foundation years. So we do internship or externship in India when we go back home. England में same होता है foundation year. इनका 2 foundation year होता है, foundation year 1, foundation year 2. These are called F1, F2. So there are multiple entry system in UK. For example, you can enter in F1 stage. For example, if you are a graduate and you don't have any internship experience, you can enter F1. But there are strict requirements for that. It is difficult. Then you can enter F2 also if you have 1 year internship and no other experience. Then you can enter F2. That is called standalone F2. Then you can land a house job also. If you have at least 24 months of experience or at least more than 1 year experience, you can land a house job. And all these things after GMC exam, after passing a PLAB step 1, step 2 and getting GMC registration. That's what we're discussing right now.
Yeah.
And then if you have a specialty, if you have already done specialization, you can land a job of a resident, not resident, it is like a
SR.
How to say?
SR.
Yeah,
SR.
it's same as SR post,
Yeah.
senior post, but they are known as registrars. The registrar. Now, standalone F2 is also a training post, which means you are in the training pathway. At the end, you will get a certificate called completion of training. Certificate of completion of training, CCT. And that gives you a pathway to enter further training, which means specialization. Like you get into training in PG.
Yeah.
You can also do house job. You can also do medical
medical officer
duties.
Yes, medical.
Yes, medical officer is not a training post. It is a job. Right?
Job.
You're doing a job. Similarly, in UK, there are jobs you can do and there are trainings you can pursue in different levels. Internship is always training, but once you get out of F2, choose to one of the two. Either you do a SHO or senior house officer job, which is the same as foundation year 2 job, but it is not of a specialty. You are basically a house doctor, like house physician, same as that. Or you enter this specialty. That is a training course, right? A specialist is always a registrar. So there are other criteria to enter in this post.
And apart from that, now, and moving on to the next question is that PLAB 2. How you manage PLAB 2 exam? Because as we know, in Russia also, the clinical exposure will be not that much. It will be there, but for that you should know Russian language very well. So how you manage that? Without doing internship also, you can give PLAB 2. So how you fill up that gap of experience, of clinical experience for PLAB 2 examination?
Yeah, so that was actually a difficult thing. I have to accept that I did not pass PLAB step 2 in 1 attempt. There are lots of people like me who had to give more than 1. I had to give 2 attempts for PLAB 2. That was mainly because of the clinical gap. So it is that you can pass PLAB step 1 along with your FMG properly ahead. If you pass your in time and you book your exam in time, everything is in line, you can pass both part 1, part 2 because they are same as I is. I'm sorry, FMG and part 1 PLAB. But for PLAB part 2, it is important that you have some clinical experience. Why? Because they will check not your knowledge, but who you are or what you are, how you are as a clinician. And they are good at it. To be honest, they are very good at it to understand who they're talking to. अगर सामने वाला डॉक्टर बस किताब पढ़ के आ गया है ना, तो पता चलता है सब कि बस किताब पढ़ के आए हो, तुमने क्लिनिक्स कुछ नहीं किया. That is true. You cannot fool anyone. You have to have clinical experience. तुम रट्टा मार लो, तुम cases recall कर लो, कुछ भी करो. There is no way you are going to perform the well or as well as the person who has 4 or 5 years of clinical experience. तो पहली बार जब मैं लैब स्टेप 2 देने गया था, I had zero clinical experience. Absolutely. I passed my FMG. I was still waiting for my extension to start. I passed the PLAB step 1, right?
Yeah.
And unfortunately, the extension delayed because the process works that way. So in the meantime, I decided to give PLAB step 2. की thought process ये था कि चलो भाई एक साथ ही सब खत्म करते हैं, बार-बार क्यों एग्जाम के लिए भाग रहा है, पहले एग्जाम देना है तो अभी देके खत्म करो. So that was the now some people may pass. I am saying again, some people may pass even without clinical exposure.
Yeah.
That may be because of luck, maybe because of like lots of things. But nowadays, at least since last 1 year, because they have changed the marking system and there are other things that they are looking for. Management गलत दिया तो भाई तुम fail. That part too. So that was the situation. जब पहले बार जब fail हुआ, I mean that was the first time I actually failed in exam.
Yeah.
पूरी यूनिवर्सिटी में कभी मैं fail की नहीं हुआ. That was the devastating time. अभी पता चला कि how important it is to have this clinical experience. So I decided to let's go with the internship. जैसा होना है extension internship जो भी है, we have to do 12 months dedicatedly, get exposed to patient, learn all those basic skills, and then you will get back to PLAB part 2 again with proper clinical. So I had to build my clinical skills during extension or internship, whichever you say. Right? Now that is important for the people who are watching this podcast because you can learn everything what is there written in the book, but you can never anticipate the disease unless and until you are seeing the patient, you are talking with the patient and working in the. क्योंकि कभी भी कोई भी patient textbook disease लेके नहीं आता. Never. तुम textbook पढ़ के तो maybe you learned everything about history taking, but you can never be perfect at it unless and until you are taking at least 100 history. Yeah. So you have to indulge. You have to make yourself busy with the patient. There are different things in different states. In West Bengal में अभी यहाँ तो internship में बस channel करो, blood निकालो, test tube करो, catheter करो, बस यही चलता रहता है. I mean, sampling, that is very frustrating. There is hardly anything to do in actually clinical stuff. These are all
these are just nurse stuff, like nurse
stuff. You need to know how to do these things, but that is not the only thing that you should be doing in your internship.
Yeah.
You should be indulging yourself as a doctor with your patients. Learn what are the treatments, basic treatment. Because once you are done with the internship, no one is going to teach you the treatment. If you are doing a clinic, an OPD, you have to know the treatments, basic treatments, right? So that is why I would ask everyone to indulge, learn from your seniors, your co-workers, and from patient. Patient will teach you. Patient will teach you more than anyone else.
Yeah.
Or of course, if you ask a question to the consultant, they will not say no. They will answer question. Right? हाँ ऐसा सोचेंगे भाई intern को क्या करना है treatment. Maybe someone will think. Maybe someone will ignore it. But if you ask 10 consultants, one of them will answer. One of them will clear it. And I'm sure if you are preparing for PLAB part 2 during your internship or externship, you will learn a lot from your preparation. And if you implement it and in your practice during your internship, you will perfect it.
While giving PLAB 2 examination, that is OSCE based examination. So can you share some the experience of that particular day you had, like how the questions are asked or how they behave with you? Like, is it very easy or like pretty much difficult or pretty much judgmental mindset they have, the NHS people? So how their behavior towards the international medical graduate?
First of all, I cannot disclose it because whenever we go into exam, PLAB 2 exam, there is a bond that you cannot speak anything about the exam or the day of the exam. So I'm sorry to say that we cannot say anything and we cannot speak about it. But yeah, I can give you a basic understanding of the exam, how it works, how the OSCE based exam works. So basically, there will be stations, right? Like a small group. There will be an invigilator or the examiner. There will be a patient who will be an actor. They are not real patient. But don't worry, you will not understand that or you will not even feel that they are acting. You will talk to them just as regular as any, the way you talk to any patient. They will have their complaints. They will have their problems that you need to solve. It could be an ethical issue. It could be a medical issue. It could be a surgical issue. Maybe you have to do some examination. They may allow you to do the examination on the patient. Maybe not. Maybe they will give you a mannequin to do the examination, right? And you will have some time, maybe 8 minutes. Within that time, you have to do all the stuff, taking history, taking examination and management, right? And that goes on back to back for 16 stations, if I'm not wrong. So you entered the exam. Once the bell rings, you enter the first room. That is your first patient. You do all the examination. You do the management, everything. You get back. Then again, there will be some time to read the questions that is given outside. Enter again, and then you get back as the time is over. There will be some rest stations, two rest stations where you have to do nothing. You have to just rest. There will be some water, some biscuits. You can have that, refresh yourself, and then again go to the next room, right? That's how this exam works. Now, the difficult part in this exam, again, I have to say that we cannot disclose anything what happened in the exam, especially on my day or anything, right? So I'm giving you a general idea. Now, the problem that I faced was was that to keep yourself concentrated or focused. Mainly, why I failed the first exam? Mainly because, as I understand that I was not used to talk to 16 patients or maybe so many patients and deal with their complaints at a stretch. I got fatigued. My brain got fatigued, right? So that is the main problem. Halfway, I was fatigued. I don't know how to deal with most of my patients. This way you cannot pass the exam. You have to be straightforward, right? You should be adequately exposed to such heavy pressure or heavy workload that you have. That 16 patients should not be nothing in front of. And that happened in Kinshu. I had to see like 20-30 patients within 6 months, in village postings, right? So those things that actually helped me to perform better my second attempt. Now, this is the main problem that people face.
So the basic moral of this discussion will be like it's better to give lab after your internship. That's better because you will be because you will be well versed with this
clinical stuff, right?
Clinical stuff. And I guess in Russia also, continue.
So just let me add something. If you are expecting to join the foundation year 1 without doing FMG, then that is not an option, right? So what you can do in that case? You cannot do nothing. So basically, you have to rely on your studies, your skills, everything that you have gathered in your medical school, and go for it. That is a gamble. It is because not everyone pass. 1 or 2 people did. Because there are people I know. If I know, which means maybe not one, maybe more than one who had passed. But it is a gamble, to be honest.
Exactly. So you have to be well versed with your internship package. Otherwise, lab 2 will be very difficult to pass. And apart from that, in Russian education system, we have the same system of actors that from first year onwards only we get the actors and we perform, like we see how they react, like we react to their symptoms and then teacher give us marks. So pretty much same, but the pretty modified version of that because sir cannot disclose that as it is bond with the NHS. But it will be easy if you do your internship in India. So thank you, sir. Thank you for your time, and that was lovely talking with you. And after lots of years, like I was supposed to take this podcast earlier, but I was pretty busy with my FMG and my internship, so we couldn't meet. But this was good. Thank you, sir. If anything you want to say at the end for all of us, just please in one line or one quote.
Don't give up hope. Things may change. Change your plans. That's how life goes, right? Nothing is perfect. Things will change, but you have to be flexible. That's the way of life.
Yeah,
that's the way.
Hope no one will give up in life after watching this podcast. So thank you, sir. Thank you for your time.
Yeah, welcome.
Thank you for your time.
Thank you so much. मैंने कभी सोचा भी नहीं था पॉडकास्ट में आऊंगा भाई. मेरा फोटो रहेगा यूट्यूब में, वीडियो रहेगा.
अभी रहेगा. ओके.
अभी रहेगा.